Dr. Hilary, what are the options? Because I was amazed to find just how often it doesn't work, things like
Sure.
IVF. It's such an emotional thing to go through, and it doesn't work very often, does it? It's only
Absolutely.
a quarter of times.
You know, 1 in 7 couples have problems conceiving, and we've talked about the emotions, and of course emotions they're significant because they can actually get in the way. But once emotions start to play a part, then they can get in the way of all the hormones that are necessary in the cascade system to cause ovulation and conception.
So it's a vicious cycle if you're trying to balance it,
absolutely.
isn't it?
So I think the first thing is to try and identify the cause of the infertility. That's obviously very logical in order to find out which treatment. Now, people can do a lot with their lifestyle. You did everything you possibly could, but some people just don't know the basics. So it's unbelievable, but people just don't know that you need frequent unprotected sex sometimes at the right time in order to boost your chances of conception. And then, of course, it's about normalising your weight, stopping smoking. Even men, if they smoke, they're reducing their sperm count by 17%. It reduces women's fertility as well. Alcohol, if a woman drinks less than 5 units of alcohol a week, she doubles her chances of fertility in some studies. So simple things like exercise, normalising your weight, healthy food and diet is really important. And then, of course, if nothing's identified, if ovulation is a problem, which it commonly is, then we have medications like clomiphene, metformin, if you've got polycystic ovaries. Then there's surgery, so you might need attention for the fallopian tubes, or a man for his tubes. And then, of course, you've got assisted conception, intrauterine insemination, or IUI, as you had, other forms of IVF. And then, of course, sperm and egg donation. So there are lots of options depending on what the cause is.
So don't give up. Go to your doctor.
Oh, absolutely.
And you know, there are success stories like Claire's despite the battles.
And doing everything you can. And once you've tried that and you've given it a fair amount of time, depending on your age, because fertility starts to wane after 35 naturally anyway, you've done all those things, then go see your GP. And depending on the trust and the local health authority, you may get a chance for IVF or some cycles. Sometimes it's rationed, but there's always help out there.
All right, brilliant. Lovely to see you, Claire. Lovely to chat to you as well, Hilary. Thanks very much indeed.